Welcome back. You're watching India Ahead News. Now, Delhi's Health Minister, Satyendra Jain, well, he said that the national capital is expected to report around 14 to 15,000 cases today. He also said that around 2.58 crore vaccines have been administered in the national capital, out of which 100% eligible population has been inoculated with the first dose, and about 80% have been inoculated with the second dose of the COVID-19 vaccine. He further informed that over 1,000 COVID cases are being reported from outside of the national capital every single day. Meanwhile, to talk more on this and to put perspective behind these numbers with scientific backing, Dr. Wali, well, he joins us live on the broadcast here. Thank you so much, Doctor, for taking out the time and helping us out with your particular perspective. Taking a look at the overall COVID numbers at the moment, Doctor, it is already a little lesser than what the country was reporting yesterday. And I know that Satyendra Jain is, of course, worried about only the national capital, but we must put in perspective the entire nation and country. Now, what many people were also talking about earlier was that the velocity of this particular peak, this particular wave, beg your pardon, and the velocity of the peak in this wave is going to be much more higher, but the duration and the longevity of the wave is going to be much lesser. Are we witnessing a similar scenario like that? Because people most certainly are still going out. Masking up is a norm, but we all know how much it is being followed. And social distancing is pretty much a myth when you look at home isolations as well, Dr. Wali.
Yes, first I will cover your last part of the query. Any laxity on our part, on anybody's part at this
Hmm.
juncture, would be quite dangerous. So we have to be very strictly following. And this we are talking immediately after experience of 2 weeks of weekend curfew, and Satinder Jain has reasons to be happy.
Hmm.
That apart, while the whole world is witnessing 270 time increase in the COVID cases, especially Omicron or Delmicron, we have
Hmm.
slight reason to be rejoicing a little bit as far as Maharashtra is concerned. And maybe in a couple of days for Delhi also, we shall be doing the same. But at present, as you said, yes, this peak is ill sustained. Peak will be ill sustained. And I'm very hopeful. I'm always positive that
Hmm.
kind of data which we are having from Delhi, keep apart those tests which people are doing at home. There's a huge
Hmm.
number of people who are testing at home and not reporting. Keep apart
Hmm.
those cases because they are all mild. There is a tendency to show a downward trend. And as we see that there is a slight shift to the lesser numbers, especially in
Hmm.
Maharashtra and Delhi to some extent.
Hmm.
We have to see this week's statistics as globally it is soaring and active cases are slightly decreasing. The positivity rate in Delhi has also dropped down from 19.65 to 16.28. This is a
Hmm.
technical reason for my statement to support that we can have a little fall in these cases. Severity of the cases is less. People are not going to hospitals much, but still we are getting figures of deaths. Where from these deaths are coming? These deaths are coming from those people who have not got themselves vaccinated, who have not had two jibes, or who have not been
Hmm.
properly following the COVID appropriate behavior, or those people who are elderly, who have got some accompanying diseases that we call comorbidities like severe diabetes, hypertension, obesity, and lung disease, or those who are smokers. So, this category apart, we have to take care of children as well because
Hmm.
majority of the 70% of the children still are not covered with vaccination. So whatever vaccination we are doing, we have again reason to be happy that we have crossed
Dr. Wali, Dr. Wali,
160 crores.
are you
Yes.
satisfied with the current rate of our vaccination drive? Are you happy and
Uh,
satisfied with the kind of norms that have been imposed by various state governments, or do you think stricter norms are now needed to completely end this transmission? Because even as cases are going low, there are, like you mentioned, people who are self-testing themselves at home and not reporting.
yes. I am in this very categorically concerned that people should report to the authorities. There is a barcode with the kit. They should come forward. If they are positive, they should report. No, nobody will torture them. Nobody will ask them to do anything super special. But they should give the proper perspective. But keeping that apart, I am satisfied with the numbers. But at the same time, I am very positive about to keep the vaccination drive on, to keep the vaccination drive going, to keep the vaccination drive with a speed. And repeatedly, our Honorable Prime Minister is coming, talking to the health workers, talking to the people, talking to the public in the Man Ki Baat. And he has impressed that only way to protect ourselves in this part of the pandemic is vaccination. So
Absolutely. I mean,
vaccination should
vaccination
not
ends
be
up being the
compromised.
biggest weapon
Yes,
against
yes,
the
yes,
pandemic.
you're right.
Dr.
Yes.
Mohsin Wali, before I let you go, we're seeing a little surge of cases in the southern states in the country. Do you see the pandemic wave now sort of like shifting towards the down side of the country, the geographical side of the nation?
Yes, it is indicated from the data coming from there, but I would say
Hmm.
that in the south, we had the first case when the COVID started. So the
Hmm.
trends coming from the southern states are still worrying, I would say, but they have different kind of demographics. Weather and cold wave, which is in the northern India, is not there in the southern India. So this part of this strain on the lungs is not there as we are having. So we have to be very careful, as well as they have to be very careful. And I would also request everybody in the country to wear mask and follow the COVID appropriate behavior. Yesterday, my son told me that people are so excited to go out that if it is curfew in Delhi, lots of youngsters are going to Noida. So this kind of behavior I would discourage. Please be assured
All right.
that you will have plenty of life to enjoy. But first thing is save your life, save the life of others, and please stay at home on the weekends at least where there is a norm. Or you should
Absolutely.
not be very excited to communicate this
Absolutely,
asymptomatic.
doctor. I mean, those are most certainly wise words coming there from Dr. Mohsin Wali, who's a consultant at the Gangaram Hospital. Thank you so much, doctor, for taking out the time and helping us put scientific backing on these numbers that people do tend to read every day. But it seems like we must read in between the lines of these numbers.